of carpal tunnel syndrome. Her symptoms?
The numbness in my finger, the tingling from my wrist up to my elbow.
A quick anatomy lesson reveals the source of the problem.
And all the tendons that go to the fingers to make them bend go through this tunnel. They cannot give. This tendons get swollen, and it puts pressure on this nerve. That's what is the carpal tunnel problem.
True or false? There's no way a patient can be tested before they complain of carpal tunnel pain. The answer is false.
A very simple field test, and actually the very first thing that deteriorates is a very slight amount of feeling loss, and those can be measured.
And what you're going to feel is like a tingling.
If the test is abnormal, the patient's told to
set up a proper workstation. And the second would be to avoid the repetitions with a little bit of built-in breaks.
The good news is that carpal tunnel syndrome can be reversed without surgery if detected early. But not all patients get the problem through repetitive tasks. Carpal tunnel syndrome can also occur during pregnancy. And what happens is there's extra fluid that collects and it causes the tendons to swell. But the good news is it tends to go away after delivery.
In the evening when I'm home, I watch.
Unfortunately, Jenny wasn't tested early and needed surgery. In my next segment, you'll see how a surgical scope is getting patients back to work quicker. I'm Dr. Larry Stoneburner, Channel 29 Eyewitness News.
And Dr. Stoneburner says the nerve conduction test has dramatically cut the incidence of carpal tunnel syndrome in a large chicken packing plant by over 90%. The nerve test was done with a neurometer, which can be brought right to the work site.